Dementia and Alzheimer's, Awareness that Empowers. Presented by Right at Home Cincinnati. What is dementia and Alzheimer's? Dementia, group of conditions characterized by loss of memory and cognitive abilities that become severe enough to impact daily function. Alzheimer's, a type of dementia that accounts for 60 to 80% of dementia diagnoses. Degenerative brain disease caused by brain changes due to cell damage. Early symptom: trouble remembering new information. Progression: disorientation, confusion, behavior changes, difficulty speaking, swallowing and walking.
Alzheimer's. What is the greatest risk factor?
Age.
Most individuals with Alzheimer's are 65 and older. Nearly 200,000 Americans under age 65 have early onset Alzheimer's. Risk doubles every 5 years after age 65 and reaches 1/3 after 85 years of age.
But age is not a cause of Alzheimer's, and Alzheimer's is not a normal part of aging. Other risk factors of Alzheimer's: 1. Family history and genetics. Having an immediate family member with Alzheimer's and risk increases as more members of immediate family have it. 2. Head injury. There is a link between head injuries and developing dementia in the future, so take fall and injury prevention measures. Risk factors, continued. 3. Heart, head connection. Conditions that damage the heart that prevent proper blood flow to the brain and increase risk for vascular dementia. 4. Lifestyle. Unhealthy diet, inactivity, both body and brain, lack of socialization, excess tobacco and alcohol can increase risk for Alzheimer's.
History of Alzheimer's. Alzheimer's disease is named after Dr. Alois Alzheimer. In 1906, Dr. Alzheimer noticed changes in the brain tissue of a woman who had died of an unusual mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. After she died, he examined her brain and found many abnormal clumps, now called amyloid plaques, and tangled bundles of fibers, now called tau tangles.
Plaques and tangles are one of the main features of Alzheimer's, but another feature is the loss of connections between neurons in the brain. Neurons transmit messages between different parts of the brain and from different body parts to the brain. Take a look at the differences in a normal brain scan and a brain with Alzheimer's.
Diagnosis of Alzheimer's. First, an interview is conducted. The doctor will ask the person and their family about medical history, family history, medication use, lifestyle, and changes in daily function or behavior. Then, the assessment. The doctor will also conduct tests of memory, problem solving, attention, counting, and language. Diagnosis of Alzheimer's, continued. Labs. Conduct general blood and specific biomarkers and urine tests. Scans. Conduct scans such as CT, MRI, and PET scans to diagnose and rule out other conditions.
10 warning signs of Alzheimer's disease. Alzheimer's disease symptoms and progression can be generally categorized into stages, ranging from mild to severe. Early diagnosis and treatment can slow disease progression. First symptoms of Alzheimer's vary person to person. Some may experience word-finding difficulty, vision/spatial issues, impaired reasoning and judgment. Others may experience mild cognitive impairment, MCI memory problems that are not normal for their age. MCI has also been linked to problems with movement and sense of smell. Not everyone with MCI will develop Alzheimer's. Mild Alzheimer's disease. The person may function independently, drive, work, and be a part of social activities, but can experience difficulty coming up with the right word or name, remembering names of new people, difficulty with tasks in social or work settings, losing/misplacing objects, forgetting material that was just read, trouble planning/organizing. Mild stage. A person in the beginning stage of Alzheimer's may not want to tell anyone that they're experiencing brain changes. Loved ones/friends should consider providing gentle reminders for paying bills or appointment times. To ease stress, encourage person to retire and put affairs in order. Moderate Alzheimer's disease, longest stage forgetful of events/personal history. Feeling moody or withdrawn more in social or mentally challenging situations. Confusion about where they are or date. Need help choosing appropriate clothing for weather/event. Trouble controlling bladder or bowels. Changes in sleep pattern. Likely to wander or become lost. Personality and behavior changes. Moderate stage. A person in the middle stage of Alzheimer's can still participate in tasks with assistance. Caregivers should find out what tasks and activities the person can still participate in and find ways to simplify tasks to increase engagement for as long as possible. Severe Alzheimer's disease. Symptoms are usually severe and communicating pain becomes difficult. Require 24-hour care. Lose awareness of recent experiences and surroundings. Experience changes in physical abilities. Walking, sitting, swallowing. Difficulty communicating/inability to carry conversation. Vulnerable to infections. Pneumonia. Increased personality/behavior changes. Severe stage. A person in the late stage of Alzheimer's may not be able to initiate engagement, but can still benefit from appropriate interactions. Caregivers should consider what the person would enjoy or appreciate, like listening to relaxing music or just a reassuring touch.
Common behavior symptoms in Alzheimer's: sleeplessness, agitation, aggression, anxiety, disorientation, pacing. Sundowning. A person with Alzheimer's will often experience these symptoms in the late afternoon, evening as daylight begins to fade, which is referred to as sundowning. Factors contributing to sundowning: mental and physical exhaustion from the day. Confusion in the body's internal clock. Reduced lighting can lead to shadows. People with Alzheimer's may misinterpret what they see. Non-verbal behaviors of others. Inability to separate dreams from reality. Less need for sleep, which can be common in older adults. Managing sundowning. Complete activities in the morning, early afternoon, appointments, bathing, trips. Encourage a regular routine. Wake up and bedtime. Meal times. Offer a larger meal at lunch and lighter meal at dinner. Get sunlight and take walks during the day and evening. Identify any triggers of sundowning. Do not physically restrain the person. Reduce stimulation in the evening. TV, loud music. A well-lit home in the evening can reduce confusion. Identify soothing activities, calm music, reading, looking at photos. Limit daytime naps, alcohol, caffeine, and nicotine. Talk to the doctor about the best time for medications. Treatment. Alzheimer's is a complex disease requiring a multifaceted approach to treatment. It is unlikely that one drug or intervention will treat it successfully. Precision medicine. Getting the right treatment to the right person at the right time. Current approaches to treatment help maintain mental function, treat underlying disease process, manage behavioral symptoms.
What risk factors can we control to prevent or delay Alzheimer's?
Mentally and socially active. Mental activities. Learning a new skill, adopting a new hobby, engaging in formal education. Challenge your mind with strategy games or high-level reading material. Social activities. Choose social activities that are meaningful to you. Clubs, walking group, book club, games group, volunteering, fitness group. Do activities you enjoy.
Physical activity. Choose activities that are socially and mentally engaging. If safe for you, engage in cardiovascular exercise to increase your heart rate and get blood pumping to your brain and body. You can choose gardening, walking, yoga, swimming, even cleaning can be exercise.
Prevent falls. Falls are leading cause of head injuries, and head injuries can impact brain function. Engage in physical activity that improves strength and balance. Organize your home to reduce fall risk. Remove clutter, keep pathways clear, have adequate lighting. Healthy diet. Heart-healthy diet. One of the best diets to adopt is the Mediterranean diet, but talk to your physician and find the best modifications for you. Focus on whole grains, fruits, vegetables, low fat, lean meats and protein, low sugar. Avoid processed foods. Be wary of medical foods and supplements. Always talk to your doctor about any supplements or medical foods you are considering. There is no single miracle food, beverage, or ingredient that has been proven to treat Alzheimer's. Quit smoking. Limit alcohol. Manage conditions like heart disease, diabetes, high cholesterol. Get enough sleep. Manage your mental health. Keep up with doctor's appointments. Make a list of topics or symptoms you want to discuss with your doctor at your next visit. Consider asking family members, friends if they have noticed any changes. Consider having a family member accompany you to visits to help with the information. Care support. What does this look like? 1. Collaborative team approach of trained private duty caregivers, skilled nursing, speech therapy, occupational therapy, and physical therapy to impact optimal quality of life. 2. Identification of the person's specific home, medical and rehab needs. 3. Educating the person and caregivers about the disease process as it relates to daily function and providing community resources for caregiver support to decrease caregiver burnout. Private duty caregivers. They provide companionship. This decreases isolation, loneliness and improves engagement. Safety oversight to anticipate needs, safety support, transfers and movement. Meals and medication to improve intake of food and liquids as well as med reminders. Education and support, to provide individualized services based on a care plan.
Speech therapy. Cognition. Problem solving, attention, memory, agitation, frustration. Swallowing. Modify diet, protect airways, prevent choking and infections. Education. Caregiver and patient education on disease process, impact on function and communication. Language. Alternative communication methods, strategies to simplify communication. Occupational therapy. Function and safety. Home assessment, modify, simplify activities of daily living, exercise and activity routine. Socialization. Provide help with behaviors, identifying triggers, setting up routine tasks. Education. On task simplification and routine. Break down steps of task, reduce distractions, use visual, audio cues. Adaptive equipment. Train on adaptive equipment for independence with tasks. Physical therapy. Function and safety. Home assessment and mobility plus balance assessment and training to prevent falls. Exercise routine. Tailored exercise through each stage of the disease to prevent injury and maximize independence. Education. Caregiver education on safety, exercise, transfers, visual, verbal, audio cues, task breakdown. Adaptive equipment. Recommend and train on adaptive equipment for adults and mobility. Thank you. Please complete post-test for in-service credit.